My name is Vlad Zaha. I'm an assistant professor at the University of Texas Southwestern Medical Center in Dallas, Texas. I'm a multimodality advanced cardiovascular imaging specialist at the UT Southwestern Hypertrophic Cardiomyopathy Center of Excellence and medical director of the cardio-oncology program at the UT Southwestern Simmons Comprehensive Cancer Center. I have Dr. William Zoghbi, is the Elkins Family Distinguished Chair in Cardiac Health, Chairman of the Department of Cardiology at the Houston Methodist DeBakey Heart and Vascular Center, and Professor of Medicine at Weill Cornell Medical College and the Institute of Academic Medicine. Dr. Zoghbi, thinking about the risk stratification for patients with hypertrophic, what are your important points that you consider in discussions with patients and with colleagues?
This is very important. What is my life is going to look like? What kind of risk do I have down the line having been diagnosed with the disease? And the risk varies depending on the phenotype of how is this disease affecting the heart itself. And the way I think about risk is there is risk of heart failure, which is not necessarily in the traditional fashion of where the heart really fails, but the heart failure with a preserved function. Basically, patients are more short of breath than usual, particularly with some physical activity. Two other risks. One is sudden death, and the third one is a risk of atrial fibrillation and therefore need for blood thinners in such an individual. So you have to think in totality for the various scenarios that a patient may have. From a heart failure perspective, if we can delay or take away some of that obstruction, that decreases the event of heart failure down the line. That can also at times be managed medically. So it depends. Not everything is surgical intervention. So the physician will talk with their patient and decide as to what medical therapy would be best. You, the physician, and the patient know how well is this therapy. What is the pressure like? So that's one. Two, regarding heart failure, what are the pressures within this heart that is not relaxing as well? Do we need additional medications to bring this pressure down and therefore risk stratifying? The third one, obviously, which is important, is the risk of sudden death. And that risk of sudden death puts together, if you will, various parameters of that. One is how thick is this heart? At times, if the thickness of the heart is above 2.5, 3 centimeters, and you could do something surgically for it, yes. And if not, you have to think of an ICD, which is obviously an internal defibrillator to prevent ventricular tachycardia and sudden death. So you have to discuss all these factors, put it together with the echocardiogram, and therefore a good discussion between the individual and their healthcare provider to make a decision as what to go, to decrease those risks going forward.